The April 26, 2016 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Brown. Here. Dr. Carbone. Here. Mrs. Conley. Here. Mrs. Draw. Here. Ms. Harris. Here. Mr. Hebert. Here. Ms. Cayley. Here. Mr. Lightfoot. Here. Chairwoman Taylor.
Here. Is there anyone signed up for the public forum?
There is not.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? Being none, we'll go to the approval of the minutes. The next item on the agenda is the approval of the minutes. You have the March 22nd, 2016 minutes and the April 12th, 2016 special meeting minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 16-0143.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Legislator Conley.
Thank you. Through you, Madam Chair, to the administration. Is there an opportunity here to decrease costs by utilizing emergency foster parents as an alternative to non-secure detention beds?
Through the chair, the detention placements have to be placed within OCFS licensed detention beds, so we can't utilize emergency foster home beds for those youth. We also don't have adequate resources to do that.
Through the chair to the administration, there are currently a few non-secure detention beds that are certified through Hillside Family of Agencies, is that right?
Yes.
Approximately how many non-secure detention beds are certified through Hillside, through the chair?
Through the chair, we currently have 2 non-secure detention beds with Hillside. Those beds are being utilized. When there is the availability of utilizing an additional bed that is also licensed as a reserve, we do use that bed as well.
Through the chair to the administration, do we use those beds before we use the beds in Ontario County?
Through the chair, we use those beds for youth who are appropriate to be at that level of care before using the Hopewell beds.
Through the chair to the administration, do the non-secure beds that are certified through Hillside, are there other agencies that can certify foster homes to the same level that Hillside certifies the non-secure detention foster beds? For example, either Monroe County or North American Family Institute?
Through the chair, the detention beds have to be licensed through OCFS.
Thank you. I don't have any questions further.
Any other discussion? Legislator Harris.
Thank you, Madam Chair. I was looking through this and I just concerned on how this will affect the raise the age process that's coming. Is this a long-term solution for the youth detainees that's in this process?
Through the chair, the use of non-secure detention for PINS youth has been what's gone on for many years. How raise the age will impact the utilization of non-secure detention for PINS youth hasn't been finalized yet.
Through the chair to the administration, do you guys have a process that you like to get to us? I'd like to know more about it. I'm kind of new in this situation where I'm trying to learn how do you plan to go through with that. If you can get that to me, I would appreciate it.
Is there any other discussion? Legislator Cayley.
Thank you. This is so unique that I get to do this twice in one day. Thank you, Madam Chair. Through you to the administration, just a couple follow-up questions on what would have been the current contract. You have mentioned Jefferson County, and I forgot the other county. Are we currently under contract at all with another detention service?
In addition to the Hopewell beds, we utilize non-secure detention beds largely throughout New York State as they're needed. We have a contract with the House of Good Shepherd. In general, the non-secure detention facilities are willing to loan their beds if they are available when we need them.
Thank you. Where is the House of Good Shepherd? Through the chair.
Through the chair, the House of Good Shepherd is in Oneida County.
Thank you. And then just backing back to my colleague's question, I realize that we have, through the chair, youth of different levels, and they would be placed where they are most appropriate. But is it correct in assuming, or maybe I'm just going to ask you, that when a youth needs to be placed that's not appropriate for Hillside, that they would then be placed as close as possible?
Through the chair, we absolutely place youth in Monroe County whenever possible.
Thank you.
Legislator Conley?
Thank you, Madam Chairman. I just actually wanted to respond to Legislator Harris's question about raise the age. My understanding is that there are multiple different pieces of legislation that are pending. It hasn't passed yet, but Governor Cuomo's plan, as well as other legislative plans, actually call for eradicating PINs altogether as part of the raise the age. So if that particular type of raise the age is passed, there wouldn't actually be any PINs cases in New York State anymore. So I would just, wait on having the administration put together a plan as to how to handle raise the age beds, because there may not be any beds after raise the age is passed in PINs. It depends on how it gets presented and whether or not it gets passed at the state legislature. But right now, the legislation is talking about doing away with PINs altogether.
Any other discussion? Being none, all those in favor signify by saying aye. Any opposed? Item carries. The next item?
Referral 16-0144, acceptance of a grant from Health Research, Inc. from the Expanded Partner
Moved
Services.
by Legislator Conley, seconded by Legislator Hebert. Is there any discussion? Legislator Cayley?
Through you to the administration. Anecdotally, through the administration, this is the 4th year that this program has being used. When do they normally drop the word pilot?
Through the chair, I'm not sure I can answer for New York State.
So, through the chair, then my understanding is that this particular wording comes down through the state, that it's still a pilot program?
Through the chair, that is correct. That is the name of the grant as they have released it.
Thank you. And then, through the chair to the administration, could you indicate how the patients are located if they are out of care?
Through the chair, we receive electronically and securely from New York State information once a month on individuals whose last known address was in Monroe County who have not had indicated blood work in the last 13 months. Our staff then goes through a complex process of determining if they are still alive, if they are still in Monroe County, and if they are still out of care. If that is the case, then they use standard public health representative techniques to locate them, identify what their barriers to care are, and help facilitate them re-engaging in care.
Thank you. And through the chair, is this service conducted by Monroe County employees?
Through the chair, yes, 100% of it is done by Monroe County Public Health staff.
Thank you. And then could you indicate through the chair what the staffing is for this particular program?
Through the chair, we have a full-time assistant public health rep, a part-time supervising public health rep, and then the supervising nursing staff.
Thank you. Are there, through the chair to the administration, are there stats without indicating anything of a confidential value? Are there stats that can be shared at a later date with the legislative body as to how this is succeeding?
Through the chair, I can share those statistics with you now. Throughout the course of the last 4 years, we have led the state with over 95% of our folks relocated and successfully re-engaged.
Thank you very much. It's very good.
Any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 16-0145, acceptance of a grant from the New York State Department of
Moved by
Health.
Legislator Hebert, seconded by Legislator Draw. Any discussion? Legislator Lightfoot?
Thank you, Madam Chair. Madam Chair, what educational intervention or opportunities have AAT taken advantage of if already provided? It says here in the second paragraph that it's going to provide medical and environmental case management and educational intervention for children with elevated blood levels and their families. So can you share with me some of the educational intervention that AAT, the acronym for accurate analytical testing? Well, yeah. Through you, Madam Chair, to the administration.
Yes, through the chair. That organization does not provide any educational intervention for children. That is strictly a laboratory that performs testing for us for our interventions. All of the environmental and educational intervention is done by our staff at the health department, but we utilize that laboratory for analysis of any samples that we have to submit in the course of our investigations. They do the majority of what they do is dust wipe sampling clearance testing analysis for us, and we actually use them for both of our lead grants at the health department.
Okay, thank you.
Sure.
It's funny, it kind of clicked for me after I read it out loud on the loudspeaker here, that they were just strictly doing testing. However, it still kind of reads as if there was some type of programming going on. And I think I heard you answer it when you said that the counties will be providing that type of programming. However, I did not still hear exactly what educational intervention services that we are providing from our organization. Through you, Madam Chair.
Yes. Through the chair, we do a full educational intervention with all the families that we are involved with. For this particular grant, this is our mandated lead program. So any blood lead tests that we receive for children that are above the state mandated level of 15 micrograms per deciliter, we are required to do a home visit with them. And the educational portion of our visit goes through all of the potential identification of possible sources of lead in their environment. We discuss nutritional interventions with them as well. Basically we are looking for any type of potential exposure that a child could have. And the parents are actually the target of that investigation as well. We do provide a lot of literature to the parents on how they can prevent exposure to their children. We go over cleaning efforts with them as well so that we can help them to identify how they can potentially reduce the amounts of lead dust that are present in the environment, and hand washing, washing of toys.
I thank you. And
Sure.
I understand now. And you answered my question thoroughly on that particular issue. So it's a mandated program, and we quite frankly work with those who need to be serviced.
Yes.
So it's not a problem. Thank you so much for that.
Sure.
It says here as well. I just wanted to speak about that there's an additional funding stream that's also there, and it's called Childhood-Led Primary Prevention Grant. And those funds are also, they run simultaneously with this funding stream that you're asking for here. Is that I'm asking that correct, to go to the lab over the 5 years?
Through the chair, yes, that is correct. In fact, the majority of the funding actually comes from the other source, the primary prevention grant. As more of our environmental investigations are performed through that grant, and both of the grants and our interventions involve clearance testing. Whenever we cite a property for lead hazards, we require a clearance at the completion of any lead hazard control work that's performed. So both grants and activities in both grants need to have this service of the environmental testing. So we are actually funding the contract with both grants as a source.
Thank you.
Legislator Harris.
Thank you, Madam Chair. I see that you have in the grant, the contract is not to exceed, through the chair to the administration, the contract is not to exceed $33,000 per year. And I have a question, what was the actual amount spent on testing last year? Does this $33,000 per year reflect an increase from last year or the same?
Through the chair, I apologize, I don't have the exact amounts with me. I believe that the amount in the childhood lead poisoning prevention grant was the same, $28,000. I think the $5,000 represents a $2,000 increase from last year, if I'm recalling correctly.
Through the chair to the administration, and what was the reasoning for the increased request for the grant?
Through the chair, I do believe that we identified that there were more funds needed for the testing allocation.
Thank you. Thank you very much. And I'd like to know, how are the families entered into this program through the chair to the administration?
Through the chair, for this particular grant, they are automatically entered into the program based on lead levels. Any lead test that's performed within New York State, the results are required to be reported to the State Health Department, and a major portion of the personnel in this particular grant do monitor all of the blood lead tests that are reported to the state, and based on that blood lead level, referrals are made to our program for the environmental and educational intervention. They also do a lot of medical case management for all children that are tested, and that can be anywhere from 13 to 14,000 children that we get results on annually. But to actually receive an environmental visit and educational intervention, that's determined by the blood level trigger that's mandated by the the New York State Sanitary Code.
Thank you very much.
Sure.
Through the chair to the administration, does that mean the families that get the actual blood levels is different from the families that you serve? Is there a difference in numbers? I'm just asking for clarification.
Through the chair, I'm sorry, I'm not sure I'm understanding your question.
So let me rephrase that. I apologize.
No, that's
The number of families that you serve, is that for the testing included, or is it that you serve them in other ways? With just education and program resources, is that all inclusive in one number, or do you track the testing separately?
Through the chair, I think I'm getting clarification. I'm sorry. We don't do the actual testing, the blood lead testing.
Okay.
The testing is done by the medical provider. So actually, we get involved and perform the services after we're notified of the blood lead test.
Okay. Thank you very much. That
Okay.
clarifies things.
Okay, sorry. Thank you.
Thank you, Madam Chair, and thank you, City Administration.
Any other discussion? Legislator Kaley?
Thank you, Madam Chair. Through you to the administration, the proposal indicates that AAT was the most qualified respondent to this RFP. Were there other responders? And if so, who they were? Who they are? Who are they?
Apologize. Through the
It's all
chair. Yes, we did have only two respondents. There was one other corporation, Analytics Corporation, that responded to the RFP, but they did not rate as highly in just about every category that we were rating them. They did not actually have even the required certifications that they needed to perform the lead analysis for us.
Thank you. And then through the chair, just last one. From what I'm reading in here, then AAT was the prior contract holder as well?
Through the chair, no, that is a new contract for us that we establish with the primary prevention grant.
All right, thank you.
Any other discussion? Being none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 16-0146.
Moved by legislator Draw, seconded by legislator Carbone. Any discussion? Legislator Lightfoot.
And thank you, Madam Chair. Madam Chair, through you to the administration, I just have two questions at this time. It states here that in the middle of the second paragraph, optimizing our electronic health record and progressing toward application for patient-centered medical home status. Yay. So, can you tell me what patient-centered medical home is?
Through the chair, patient-centered medical home is a status, a status that really is going to become a standard of care community-wide. Application to become a patient-centered medical home involves meeting a number of qualifications, a large number of qualifications, all of which really lead to enhanced care. Things, for one little example, like having the capacity to provide same-day appointments to patients who call in, whether it's for an urgent or a non-urgent issue. The ability to be able to schedule that patient the same day that they call in to be seen. That's one little small aspect. There are a number of qualifications required, and all of these really lead to better quality of care and also presumably, theoretically, to a reduced cost of care as the patient care is improved.
Okay, great, thank you. So we believe that this status is something on the horizon, and we predict that. Thank you. After this, it states that somewhere I read that it's going to be meeting some benchmarks, and I guess my question that aroused was, through you, Madam Chair, to the administration was, can we have a list of those benchmarks, or can you share with us? I mean, I don't need a. Yes, I would like a list of those benchmarks in written form. However, if you could just share with us verbally, not an exhausted list, but some of those benchmarks, so I can get an idea of what you may be talking about.
Through the chair, the list would be extensive, and we can compile a list for you and provide that. Some examples would be training for staff, consultation among staff, patient-centered consultation. For example, when at the beginning of a day, when patients are scheduled, rather than to just have them appear and people respond to whatever their situation appears to be at the moment, for the staff to briefly each morning get together and talk about who's coming in today, what is the primary problem, what are we seeing them for today, and what is the plan for the day. Those are two very brief examples. And if you like, we can compile a list. It will be extensive.
Well, I'm not necessarily sure I need the complete extensive list, but I would like to learn more of what the benchmarks are. So I don't need an exhausted list, but a list would be good.
Through the chair, maybe an outline for major topics, for example?
Sure, we'll start there. Thank you, Madam Chair, through you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Are there any other matters to come before the committee? There being no matters, the April 26th, 2016 meeting of the Human Services Committee now stands adjourned. The next meeting of the Human Services Committee will be on Tuesday, May 24th, 2016 at 5:30.